And in our top story this hour, we take you to Parliament, where the Health Minister, Dr. Zweli Mkhize, says the COVID-19 storm that he's been warning about has arrived. The minister was delivering an executive statement in the National Assembly a short while ago. His statement comes as more than 200,000 infections are reported countrywide, and the death toll breaches the 3,500 mark. Mkhize says government has been using a differentiated approach in the response to COVID-19. He says in all areas classified as hotspots, the focus continues to be in prevention over the new infections, containment, mitigation and recovery. He also says that due to an increase in cases as of the 7th of July, the department has activated 139 quarantine facilities.
The Western Cape continues to have the highest number of confirmed cases at 72,156, followed by Gauteng at 71,488, Eastern Cape at 40,401, and KwaZulu-Natal at 16,743 confirmed cases. We however expect that Gauteng will be the highest number of confirmed cases when we next make the announcement, making it the epicenter in the country. We have used a differentiated approach in our response through a classification of districts as areas of low transmission or vigilance and high transmission, or what we call hotspots. In all the areas, the focus continues to be on the prevention of new infections, containment, mitigation and recovery. The overarching objective is to strengthen the national and provincial mechanism for detection, management and containment of the spread of COVID-19 with 9 overarching strategic priorities or pillars, which are the following. 1 is providing effective governance and leadership. 2 is strengthening surveillance and strategic information. 3 is augmenting health systems readiness by assessing health systems readiness against the epidemiological curve, identifying the gaps and planning to ensure services availability according to the need, focusing on the workforce, health workforce, beds, medicines, equipment, and products. 4, enhancing community engagement by ensuring effective communication to the public and improving laboratory capacity to test by strengthening the national health laboratory services, as well as the private laboratory capacity for testing COVID-19 to meet the requirements of the response and improve the coordination between the public and private sectors, and clarifying care pathways in respect of case detection, management and clinical pathways, and to align the hierarchy of facilities established or reconfigured for COVID-19 response, and scaling up infection prevention control measures and strengthening capacity at ports of entry by enhancing screening capacity at the key entry points.
All right, and for more on Minister Mkhize's statement, we joined via Skype by Professor Adrian Puren. He is the head of the Department Center for HIV and STI at the National Institute for Communicable Diseases. Prof, good afternoon to you. Thank you so much for joining us.
Good afternoon. Thank you very much for the opportunity to be on your show. Thank you.
Thank you so much indeed for coming through. So your overall impressions on the Minister's statement on the impact of COVID-19 in the country?
It's unfortunate I haven't been able to visualize or listen to the particular talk, but if there are specific points that you would like me to go through, I'm quite happy to answer some of or respond to some of the particular points that you would like to highlight.
So let's just start with the prevention strategy. We do know that there have been concerns previously about the effectiveness of the prevention strategy that we have in the country. So we had the minister defending the strategy, but also talking about the surge strategy. This, of course, in anticipation of the peak of the coronavirus.
Yeah, so it's really critical that we take note of this particular strategy. That's really the only mechanisms that we have available. As you know, we had the lockdown, and that was a blunt instrument that really physically contained everyone or most people, and there was no movement, and therefore we saw the declines in the numbers of cases that were observed in terms of the laboratory testing. But as we've unlocked from levels 4 to 3, and presumably we'll go to levels 2 and so on, that responsibility about transmission and preventing transmission is really our responsibility as a country, as individuals. And the only elements that we have available for us is really the physical distancing, the hand hygiene, the wearing of masks, the coughing etiquette, and making sure that the various policies with regard to movement of people, so for example in taxis, buses, transport, at schools or at work, all the relevant policies are in place in order to ensure that these non-pharmaceutical interventions, or NPIs, are in place and adhered to. And that means trying to ensure that we be practical about how to manage these particular NPIs in order to ensure that we try and prevent transmission of the virus. So I really would encourage, the Minister has stressed these particular points, and he's done this very often, because those are the only interventions that we have currently. We don't have a vaccine. We have limited interventions at the level of the ICUs, for example, with regard to oxygen use and dexamethasone, but that's in a particular group of individuals. That's the group of people that we want to prevent getting to that particular point. So I know that the majority of us will have what we call a mild disease and recover, but I think it's really critical that we bear that, even though that may be the case, it's really that group of individuals that are at high risk that we want to prevent from getting to our ICUs and high care centers.
So you talk about protocols like washing your hands regularly, sanitizing your hands, wearing your masks. Those are precautionaries, of course. And I would want to imagine that these are even more important now with that team of scientists who are saying that there is a possibility that COVID-19 can be airborne.
Absolutely. And in fact, it complicates some of our strategies. But I think that we need to adhere to those key strategies. I think the discussion and the controversy has been around whether or not it was in large droplets that the virus was transmitted, and therefore the physical distancing of 2 meters or 1 meter was recommended, as well as the wearing of masks. But now the additional consideration that in fact it could be in smaller droplets means that that virus will spread further along the way and in fact be viable for longer as well. And therefore, our additional considerations, for example, would be within perhaps confined spaces to ensure ventilation. I know that if you're in a combi or taxi combi, for example, how do you ventilate adequately in this cold weather? But in buildings, for example, again, are there mechanical considerations for us to improve ventilation? So these are the additional add-ons that we may want to consider, but I think it certainly emphasizes the needs for us to adhere to, for example, the physical distancing and the mask wearing, for example. I think the WHO probably had some considerations or concerns, as you know, in the early phases about the wearing of masks broadly, was because the WHO was concerned around the fact that PPE had become scarce for our healthcare workers. And therefore, if you're really going to apply the fact that aerosols and the small droplets specifically is critical in terms of transmission, then consideration for N95 would be the optimum consideration. But I think we still need to ensure that we don't deprive our healthcare workers of the PPE that they actually do need, and adhere to what we can certainly do with regard to either ensuring as far as possible the physical distancing of 2 meters, as well as the wearing of hand masks. And obviously the hand hygiene is also really, really critical as well.
So on the issue of PPEs, Prof, the Minister responded to that particular concern, saying that as of the 7th of July, they had sufficient PPE stock available that could meet the requirements of frontline healthcare workers. But let's just also talk about the availability of beds in the country. I know that was a major concern. So the Minister saying that from as of the 7th of June, they activated about 139 quarantine facilities, which translates to just over 12,000 beds in the country.
Yeah, so this is very important. As you know, when we had the lockdown, the major point around that particular lockdown was not simply about prevention of transmission. It was also around preparedness. In other words, it was shifting the curve and lifting the line. And the lifting the line was really around preparing as much as possible in terms of access to healthcare. And part of that would be obviously to ensure that we had the appropriate number of beds available in hospitals, in the different settings within those hospitals, in particular around high care and ICU. And there have been various mathematical models to try and guide the actual requirements. So I think we're probably trying to meet those specific targets. But I think the idea again is that we mustn't aim for those particular targets to get people into hospital. I think it's still a matter of trying to say, well, what can we still do to try and not exceed those particular targets? Because I think that's the primary concern, is that we exceed those targets, we really are going to see what we've seen in various other countries. So I think it's really critical that we still come back to these particular points, that we want to prevent transmission in order for us not to exceed those particular targets. I think the Minister of Health has also spoken, and maybe has done so again today. I just heard a little bit of what he was saying at the end, is really to combine the public and health sectors in order to try and maximize our capacity to manage the numbers of patients that we may well see if we don't prevent transmission. I think we're going to obviously see an explosive increase in the numbers of patients or people being infected, but it's really trying to prevent people getting to the hospitals, yes.
And of course, Gauteng is expected to overtake the Western Cape. Prof, that's where we'll leave it. Thank you so much for coming through.
Absolute pleasure. Thank you very much for your time.
Thank you so much indeed. Professor Adrian Puren is the head of Department Center for HIV and STIs at the National Institute for Communicable Diseases, analyzing the minister's statement earlier in Parliament. Let's